You mean John Libowitz? Well, it was fun. It was fun. I was the funnier guy in the household, but he got laid a lot more than I did. I don't really know. No, it was. Look, can I tell you, John is. Here's the thing about John that you should realize as you know, just watching him. One, he has become the primary source of news for a lot of Americans because, and I'm not sure that's such a terrible thing because you'll see in his coverage, he lays the foundation of the news before he satirizes it, and he's fairly equal opportunity. You know, he kind of gives it to everyone, but he also something else. He really believes stuff, you know, and sometimes it comes through. You got to wait till the interview parts of his show to kind of see. He really believes stuff, and he's a good man. I had not been on until recently because I never, you know, I didn't have a book or anything, and I wasn't promoting, you know, I wasn't one of his comedy buddies promoting some miserable movie, but he's a good guy, and someday when we have a little more time, I'll take you on the Soho tour of the places that John was busboy before he became a big star. Yeah, well, it's a good question. I've been thinking about this a lot. Look, I think that, first of all, we're going to have this near-term fight over this notion that they want to, I think they so-call it, repeal and replace. And I think that we have to immediately start getting to a place where we have our effort that's organized fairly well to what I'm calling, it's not great, but, you know, implement and improve, where we make sure that in states around the country, if they want to engage in the fight about repealing it or doing the lawsuits and stopping, I think we have to engage them. We have to engage them rhetorically. We also have to engage them legally. By the way, for those of you who are unfamiliar or just have only watched this issue casually, it's an interesting legal argument about whether or not what we've done in this bill is in fact violative of the 10th Amendment of the Constitution, which broadly written says that any rights not enumerated in the Constitution are reserved to the federal government or to the executive in some form or to the federal legislature are reserved to the states. First of all, everyone is a states' rights advocate until they believe something. Like no one's a states' right advocate on some issues because they just don't want every state to be making its own decision. But it's not a trivial fight. What's important to remember about the requirements in this health care bill is that you could choose not to be covered by health care not to get health insurance if you want. But if you do that, your right to do that costs all of us money. So you have to pay for it. So you have to pay a certain amount. It's not a lot. It's a few $100s, as much as maybe $1,200. And so when people argue around the various states, and by the way, they're almost all Republican attorneys general, and many of them are running for a re-election. Some of them are running for governor, the ones who are challenging the law. They're making this argument, you don't have the right to tell North Carolina what to do, etc. Well, in fact, the matter, the way we wrote the bill was, no, we're not telling someone they have to do it. But we are telling them that they are shifting their responsibility to the state. They have to pay a little extra in order to do that. In the constitutional construct, the right of my fist stops at your nose. You have the right to do whatever you want so long as it's not impacting on the rest of us. So one is we have to engage them in all these states. And by the way, I think it's a great political opportunity for us. Let them go in states like North Carolina, in these states where they're trying to gain traction politically. Let's engage them in that fight every step of the way. They're also going to take steps to try to slow down the implementation. We have to put a lot of pressure on the Obama administration to hang in there, to give as much support as they need to quickly implement a lot of these things. A lot of these things have statutory timelines when they begin that say that you can start it earlier if you're able to get the infrastructure up and running. Then almost immediately, I think that we have to start thinking about ways in a community fashion about how we would improve the bill. One of the things that I'm trying to do now, it takes a little work, is I'm going to digitize the bill, not just put it online in a PDF. I'm going to put it on a digital form so people can go in and make comments and ask questions right in the document. Good. So that we can start a community conversation as citizens. You know what? Wouldn't it be great if this level was different in different states? Or wouldn't it be great if this thing kicked in sooner? Or what does this provision mean? And then someone can go in and answer it. Because I think we should start right away the idea of instituting state-by-state public options if states wants to. So we go to the State Insurance Commissioner in New York. They can, if they so choose, in their exchange, it's going to have to be passed by the state legislature, has to get approved by the state, by the federal government. But we have to start incrementally improving these things right away, is my view. First, let me just say this, and this doesn't get explained enough, and I don't think the President's explained this enough. Healthcare is such a drain on our employment, and in an unseen kind of way. They made Chevy Impalas on the Canadian side of the Michigan border and on the Michigan side. The exact same car, the exact same models, the exact same union contract, in fact. It's a North American contract. But still, GM had to pay $7.25 more an hour for the workers on the United States side because of the higher healthcare costs they had there. And they eventually closed their plant. We have such a drag on our economy now because so many businesses are making that same assessment. Our incomes have been flat for 9 years now. Largely because every spare dollar an employer has to go into the healthcare fund just to keep up with the same benefits. If you know people who are active in the labor movement, every single fight they've had for the last 20 years has been about keeping health benefits or maybe incrementally growing them. Fights over wages are almost unheard of nowadays. They don't even bother because they know how many resources are going in. And it's also important to remember something else. Some of our friends in politics, they talk about what other countries do as if it's almost antithetical to the American ideal to even talk about what another country does. Well, if you were opening up a shoe store on the Lower East Side, you'd be an idiot not to look at other shoe stores in the area and see what they're doing. You'd be dumb. That would be a dumb way to open a business. Yet we as a country seem to believe, we can have super expensive, just above average health care for a portion of our people. That's cool. Let's move on. It has an enormous competitive disadvantage that we're building in. So I would just remind you that jobs and healthcare don't believe the stipulation that, okay, we've done jobs first, and now we're going to do healthcare. But I do believe that we learned a lot from the stimulus bill, what works and what doesn't. We basically did 3 things in the stimulus bill, all of which worked to some degree, some better than others. First, we gave money to states so they didn't have to lay people off. And that's the simplest way to put it. We gave billions of dollars to New York State so they can give money to New York City so that they didn't have to lay off teachers and cops, and essentially forestalled their worst economic downturn later, but we bought them some time. That's about 1/3 of the money. About 1/3 of the money went to giving middle-class people tax breaks in their payroll checks. It worked, but not great. What you wind up doing is when people get $20 or $30 or $50 extra in their paycheck, what we're learning is with so much debt, people just paying down debt. Maybe they were putting a little bit of it into the economy, but not the kind of buying that we wanted to see. The third thing that we did that is only now really gaining steam and has been the source of the criticism of some of people who have been critical of the bill is we put people to work building stuff. We just did it the old-fashioned way that we said, look, there are things we need, infrastructure we need, labor costs are relatively low right now. Now's the time to fix the bridges. Now's the time to build the schools. Now's the time to wire places for the internet and the like. I believe that we should embark on a second stimulus focusing on that third most. That I think that if you consider the most direct stimulating impact, that's the way you do it. We know it from some precedent. We also know from watching now that this money's getting out there. And the reason it didn't go out faster is for all this talk about shovel-ready this and shovel-ready that. Every single project takes a little while of gestation before it gets up and running. So that's what the conversation. We're also talking about another thing, about the idea of creating infrastructure trust funds for the states to tap into. That if we're going to print money, there's no reason why that money should only go to a Wall Street bank to disseminate. Why don't we go into the business ourselves of being bankers to states and localities to do the big construction they want to do? If we're going to print money, and by the way, we don't say it's a free ride, you've got to pay the money back, but you're not going to borrow at market rates. You as a state can't run a deficit, so it's hard for you to borrow big amounts of money. So some of us in Congress are toying with the idea of kind of a government infrastructure bank which goes to entities, mostly states and cities, but also available for nonprofits to do big infrastructure things, which would also get that money into circulation coming back in both directions.